4 seniors died of Strep A bacteria recently after 2 outbreaks at Montreal private seniors' residences. Joined now to tell us more about this bacteria is Dr. Matthew Oughton, Infectious Disease Specialist at the Jewish General Hospital. Thank you so much for joining us, Dr. Oughton.
Well, thank you for having me on.
So can you tell us what is Strep A bacteria and how contagious is it?
Probably most people have heard of group A strep in the context of the famous strep throat. It really is a very common bacteria to cause a whole range of infections in people, children as well as adults. And it can do anything from fairly minor skin infections through to the strep throat that I mentioned, but it can also cause very severe and very invasive infections.
Would you say then that people, particularly vulnerable people like seniors, can die from this bacteria? And, with that in mind, should people with family members in long-term care homes, be concerned about this?
Certainly, it's well recognized that it can cause outbreaks in group living situations. Perhaps long-term care facilities are amongst the most common, although over the years we've also seen similar outbreaks in things like college dormitories and military barracks. Unfortunately, it is relatively easily transmissible. On the other hand, it is relatively easy to detect with fairly common laboratory tests. And a lot of the measures that most reviewers are probably familiar with, especially after the pandemic, distancing, masking, being in isolation where people are wearing some protective gowns and gloves and so forth, all those measures that are now familiar after COVID-19 are exactly the same measures that need to be done to stop the chain of transmission of group A strep.
Changing topics now, public health officials have also confirmed that a child under the age of 5 years old has contracted monkeypox in the Montreal area. Is monkeypox dangerous to children, and where are they likely to contract it?
It certainly can infect people of all ages, and certainly amongst the groups who are at higher risk of severe complications include the very young. It's certainly not anywhere nearly as common to see an infection in a child during this current outbreak that we've seen over the last several months. At the present time, there's somewhere at around 20 or so confirmed cases of children here in Canada. Thankfully, that absolute number is a lot less. Monkeypox appears to be transmitted through different mechanisms, but most notably prolonged close contact, such as can occur in a household setting if you are if the child is living with someone, an adult who has it, and they're engaged in the usual things you do in a house, changing clothes, cuddling, giving hugs, bath time, all those things would be means by which you could transmit from person to person. And certainly monkeypox has also been seen to be transmitted through inanimate objects like contaminated bed sheets, for example. If there's anyone in the house who has monkeypox, then as much as possible, there should be some distancing. That said, of course, I'll remind your reviewers that there are many causes of viral illness that can feature rash well beyond monkeypox, and certainly much more common that we'll see in children even at this time of year. So just because you see a rash, don't necessarily jump to the idea that it's monkeypox. But if you're concerned about your child, then of course, contact your child's primary healthcare provider to get an evaluation.
Okay. Thank you so much, Dr. Oughton.
My pleasure. Thanks for having me on.